Okay, thank you, sir. Good afternoon, all. Today we are going to see the case conference. We are seeing the patient. We'll see the demographic data of the patients. We can call him Mr. HV. He is a 34-year-old male who is unmarried and who has completed MSc Physics, and he has been working as a physics teacher. He's hailing from Tumkur, Karnataka, and the informants were the patient himself and his mother, and the information was reliable and adequate. The chief complaints during this course of admission was the actions being controlled by external force since past 1.5 years, and wandering behavior since past 1.5 years, and abnormal posturing for long hours before 3 days of current admission. History of presenting illness: the onset was acute, course of illness was episodic, the precipitating factor was samyama meditation, and the predisposing factor is psychosis in father. It's query, it's not diagnosed. And we'll see the history. The patient, who works as a physics teacher in a coaching institute, was apparently well 1.5 years back. He's a follower of Isha programs. In the 3rd week of December 2022, patient attended an intense meditation program for 8 days, which is called as Samyama. On the 2nd day, he felt he was drifting out of his body through an open channel on his head, and his limbs were going cold. He felt he was going to die. The coordinators found him feeling uneasy and tried to help him. He continued the meditation and completed 8 days. He came back to his residence where he was staying alone. After 2 days, he called his close friend for help, as he was feeling odd experiences, like he was drifting in and out of his consciousness. The friend took him to his home and observed him. During this time, patient was staring at the wall vacantly, did not respond much to conversation, used to drift away in the middle of the conversation, did not eat or sleep much for 2 days. On the 3rd day, patient ran out from the house and tried to hug the trees and lick the bark. When asked the reason behind such behavior, patient explained that he is being sucked out of his body and he has to somehow ground himself to the physical world. The friend informed a coordinator at Isha Foundation, and the coordinator visited the patient in his friend's place and advised him to avoid all yoga and meditation practices for the time being. Patient's friend knew a psychiatry resident and was brought to NIMHANS casualty on 22nd December 2022 and was treated with injection haloperidol and lorazepam stat and was prescribed olanzapine 10 mg. He was discharged on the same day. Subsequently, he walked into IMD on the same day, that is our department, integrative medicine department, where he was advised admission. On 23rd December, he was admitted in our department, and the urine analysis for substance use was analyzed, and it was negative. Olanzapine was withdrawn as the patient was asymptomatic from 24th December. Patient was observed till 29th December and discharged. During his stay in IMD, his friend stayed with him for initial 2 days, and then his mother, who stays in Tumkur, came to stay with him. Post-discharge, he wanted to stay alone in his house and send back his mother to his hometown, although she expressed desire to be with him for a few more days. He rejoined his teaching job, but stopped going there after a week as he felt it was a waste of time. Mother insisted to visit her at Tumkur, but he kept postponing the visit. His mother inquired if he would come to Tumkur on Makar Sankranti festival, on which day inauguration of Adiyogi statue was also scheduled. He disconnected the call subsequently and said that he would be visiting the inauguration program at Isha Yoga in Chikbalapur. He reported that he would feel energized after attending the function. The volunteers who have been calling us brahmacharis at Isha already know that I am destined to visit Isha. He visited in the inauguration program, and while coming back home on a two-wheeler, he felt in the midway Sadhguru himself was riding his bike and he was just passively sitting. This he reported to his mother. For the next 4 days, his phone was switched off and his mother couldn't contact him. The mother had to call his friend who visited the patient at his home. He did not sleep or eat for 2 days and reported certain thoughts. Later, his friend took him to his mother's home at Tumkur. The thoughts were like, after the inauguration program on Makar Sankranti day, patient felt that he is being controlled by Sadhguru partially. He experiences mental and physical pain, which is a part of an occurring transformative process in him, which he attributes to Sadhguru. The patient is not comfortable with his transformative process and is trying to resist. He also felt that Sadhguru made him sit still, and while sitting, he experienced in his mind all life events like a movie. He also feels that the post-samyama meditation, there is an impression of having spiritual attainment, which renders him always available to Sadhguru's access, which enables Sadhguru to manipulate his thoughts and actions, and also the actions of people whom he interacts, to get the desired results. He felt that all the experiences of Isha programs were too intense, that he had been pulled out of his body, that made him uneasy and wanted to ground himself. He unknowingly scratched himself to bleed at the same time and realized that he was in his physical form. He feels Isha programs are part of transformation process, which involves opening of the third eye that will result in attaining spiritual awareness and expansion of consciousness. He's expecting that he will hear a loud sound like shh. Generally, Sadhguru makes the sound when the third eye opens. At his mother's home, he sat aloof and ate very little food. Mother reported that one day she saw him spinning very fast like a fan, and he fell on the ground, which recurred 4 to 5 times in a period of 1 week. So this patient says that the spinning is a consequence of a spiritual attainment guided by Sadhguru. And before such experiences, Sadhguru makes his fingers to tap in a tune of the song, Sadananda Rubam Shivoham Shivoham, which the patient has been considering as a prodrome of spinning experience. Mother and patient also report an episode of nasal bleeding, which the patient attributes to blood collection in the third eye region. Mother sought medical consultation. MRI brain showed a right sphenoid sinus mucosal, small cyst in the posterior wall of nasopharynx measuring 5 to 10 mm. He was advised saline nasal solution and antibiotics. As this kind of behavior was bothering mother, she brought him again to casualty where he was treated with flufenazine stat. And patient was later admitted under IMD and was started with aripiprazole 2.5 mg, for which he reported restlessness in the month of February 2023, which we doubt as drug-induced. The aripiprazole was stopped and started with amisulpride 450 mg and clonazepam 0.25 mg. Patient also underwent classical Virajana procedures from the Ayurveda side and followed by Nasya and Dupana. Afterwards, patient was discharged and was sent with his mother to Tumkur. During that period, patient did not go for work or socialize. He again went to few meditation programs at Isha Center, and poor adherence to medications were noted. Patient was readmitted in IMD in July 2023 in view of refusal to food and medication, decreased sleep, odd gestures, and disorganized behavior. Patient was restarted with antipsychotics, including injection flupentazole. 3 depots were given. And along with that, Ayurveda treatment was also done like previous admission. Patient was discharged after 3 weeks of IP care as the patient and as he was feeling better. He was readmitted again in August 2023 as he presented with depressive symptoms, including fatigueness, passive death wishes, hopelessness, and helplessness. During the previous discharge also, patient discontinued the medication after 10 days. So patient was started with antidepressants along with antipsychotics, and he was feeling better. And he was again readmitted in November 2023 as he presented with severe restlessness, feeling discomfort from inside and inability to sit at one place. At this time, depressive symptoms were under remission. He was started with risperidone, THP, fluoxetine 25 mg, and injection flupentazole depot, and clonazepam 0.5 mg. Post-discharge in December 2023, patient got appointed in a reputed institution with a good salary scale, but rejected the offer. Within 2 weeks, left home and went to Isha Foundation as he felt like Sadhguru wants him to be there. Also, patient discontinued all discharge medications. Patient stayed there for 2 months by doing seva. Afterwards, as patient felt like getting a call from the Supreme Energy, he left for pilgrimage to holy places like Kashi, Haridwar, and Rishikesh. Patient was wandering in holy places for about 2 to 3 months and reported that he experienced various magical or unbelievable incidents, according to him, which are paving more strength to his spiritual journey. Patient reported that he was maintaining physically well throughout the travel. Patient also mentioned about the telepathic connection between him and Sadhguru, and also his actions, thoughts, life decisions, everything is being controlled by the Supreme Self. Also, sometimes the actions of people near to him. Patient reported an incident during the pilgrimage in which he involuntarily tried throttling himself with a scarf wherein he felt near to death experience and was able to pursue the secret of this universe and in turn experience the ultimate bliss. He considers all these magical experiences was the preparatory phase of his journey to Samadhi. And also this helped him to completely surrender to the Supreme Soul without any confusion between real or unreal. Patient returned back to his home 3 weeks before. Mother reported that he was in a disheveled state and also noted to be socially withdrawn with decreased sleep, reduced food intake, poor self-care, and occasional irritability. Mother reported that he was talking about his third eye has opened and all chakras will be opening soon, which mother was not able to understand. On 19th of this month, at night, patient refused for food and started abnormal posturing, bending forward, banging head, grimacing, mutism, and also patient was not responding to the surrounding events. Mother approached NIMHANS next day morning. Patient was admitted in psychiatry short stay. On evaluation, it was revealed that he was experiencing catatonic symptoms and was administered with injection lorazepam 2 mg IV, afterwards which he started responding and agreed for food intake. Later started with risperidone 2 mg and lorazepam 2 mg. Patient then was shifted to our integrative medicine department on the next day for further intervention. This and coming to the negative history, he doesn't have a history of intracranial pathology, and there is no patient denies the history of hearing voices in isolation or seeing things which others can't see. No history of over cheerfulness, over talkativeness, and there is no history of substance use also. And this is a treatment history, which is also already mentioned in the history of past presenting illness. And while looking at the family history, he's the single child of his parents, and his father was a yoga instructor. He passed away at the age of 42 with due to stroke, but without having a history of psychosis, which is not diagnosed. And coming to the personal history, he was a full-time normal vaginal delivery, attained milestones at appropriate ages, no serious physical illness in childhood, and temperamentally he was an easy child. He didn't show any temper tantrums, intelligent child, curious, adventurous, used to solve max problems in his own method, had a lot of kids and parents in the neighborhood admiring his qualities. He scored 95% in 10th and 90% in 12th. Like just personal history if you're assessing, like his prakriti is kapha pitta and Agni appetite, that is normal, bowel is regular, and sleep is occasionally disturbed. And general physical examination, everything is fine. And coming to his premorbid personality, social relations, he had a bonding with father. Father inspired him to follow the path of yoga and spirituality, not much closer to mother, lived alone, had few friends, picky in choosing friends. Intellectual activities were reading books, especially those related to yoga, spirituality, and used to discuss his ideas with others. His mood was mostly cheerful, relaxed, and calm. His character attitude towards work and responsibility, he welcomes responsibility, makes decisions independently, methodical, not always cautious, determined but easily bored. IPR, he was self-confident, insensitive, but not adaptable or rigid. Habits, there is no history of substance use, medications, but he is a vegetarian. It's only fresh warm food. So, hello, sir.
Yes, so now we have listened to the history. Now I would like to ask, all of you who are there online and offline, to please share your views. Do you think he is spiritually advanced, or do you think he has psychopathology? And what are the points through which you justify your statement? One second. Yes, anybody?
The first point is like regarding the history of spiritual practice.
Yeah, wait, Aishwarya. Let people first share their views.
Okay.
I think Vaishnavi and Dr. Meena have unmuted. Yes, Vaishnavi.
Well, sir, as far as conduct was like he was interested in practicing yoga, reading books of yoga and all. But then It is not clear whether he used to follow this yama and niyama properly or not. Family history also, if a father has this psychosis or something, and then if you get through his eating and sleeping habits, it is more towards extremities.
Hmm.
If the socializing factors and all are considered, like more sort of avoiding social thing and all, and then irritability was noticed. There was this catatonia, which suggest more of psychopathological things rather than spiritual advanced person, in my opinion,
Very,
sir.
very well answered, Vaishnavi ji. Yes, Meena madam.
Yeah, no, basically, if you look at the whole flow of events in the person's life, you can see that most of first thing which was difficult to take for a spiritually advanced person was that there's some external agency which is trying to control him. And then he had a sudden episode of fear, and he ran and hugged the tree. So fear is very much against towards spirituality, and it's more towards, it's not towards spirituality, it's towards the psycho business. And then later on in his life, he stopped working, and he refused to work even for a reputed firm. There are episodes where he was trying to, resist pain and inflict pain to see if he's physically present or not, which are again, not for spirituality. He had disorganized behavior. He had a sense of hopelessness and helplessness because he was controlled by an external agency. And he was restless later on. As a child also, he was not very adaptable, quite rigid, and easily bored with things. So he was aspiring spirituality, but the traits and the flow of events say that they are more towards psychopathological problems rather than spiritual advancement.
Yes.
The main thing I would say is fear, as well as hopelessness, helplessness, disorganized behavior, restlessness. All of them are like against spiritual advancement.
Yeah. So Dr. Meena says that fear, you don't see much of that fear in spiritually advanced people. 1 second, one student here wanted to ask a question. Yes, Bhumika.
I wanted to know that his father died with the stroke. How old he was?
Very important.
Unable to hear,
Aishwarya,
sir.
very important question. I think Bhumika has asked, what was his age when his father died? Aishwarya?
Yes, sir. He was like 10, 11, that age.
Okay.
So that is very important because that is the time when the child looks for a role model and father has been guiding him in spirituality. And then father goes away, he naturally tries to cope, probably taking Sadhguru as his father, or in that way he maybe start using spirituality to cope from that phenomena where he wanted a guidance, and he so from that age, he came to Isha much later, no? So from that age of 10, 11, was he having any other guru or any other way in which he used to explore his spiritual dimensions? Any information you have?
As far as we know, there is no one like that, sir. He used to read books and yoga. His father was a yoga instructor, no? Only such informations we have actually. But he used to read a lot of books and go into vacant places and be alone, immersed in reading. Such kind of activities were there.
Yeah, he says that like Sadhguru, he also used to roam in the mountains alone. Even in the night as a child, he would go and roam in the mountains, and those things were there. And so there is no history of following a systematic path of yoga. Like you go step by step, guidance, that is not there. Whatever he understood in his own way, he was trying to do it. Yes, Dr. Vaibhav.
Sir, actually, I have a question here. Like, what are the source for psychiatric science to consider it's abnormal and normal? Actually, like, if we go by spiritual literatures, it gets quite confusing actually to differentiate between psychopathology and spiritual awakenings. Like maybe in one contrast, we can say that something that is self-harmful, the process which is the process that is happening and it is harmful to the person, we can consider it somewhere as psychopathology. That is one criteria we can consider, uh, but like but there are some, like we come across several spiritual teachers and several techniques and several like communities wherein the process through which the process that they follow, they themselves seem like like psychopathological, but as per their perspective they say that, they even give the scientific evidence as well many a times. They say that the process is a healing process, like we see people walking in fire, etc., and all that. So like what is the gray area, and how does the psychiatric science chooses to differentiate between psychopathology and spiritual awakenings? Like
Yes,
it's a question.
this is a very, very fundamental question, Dr. Vaibhav. What is the
Yes, sir.
definition of normality? How do we decide in psychiatry what is normal, what is abnormal? Generally, the idea is what maximum number of people follow, that we consider in society as something normal. But if you look at, philosophers like J. Krishnamurti, they say that what maximum people follow is not normal because maximum people in
Yes,
society
sir.
are sick. Okay.
Yes, sir.
So this is something, which is a topic of debate. And many people, when they say that, okay, he is not socio-occupationally functional or he rejected a job, we also see that people who are, have reached some spiritual height that we understand. Sadhguru in his life also rejected many jobs.
Yes, sir.
In the same way, whether that holding on to a job or what people want you to do, whether you are able to prove it to the people is the criteria. But ultimately, if you look at Sadhguru's life, he has been able to help many people. But there was a phase in his life where he was isolated, when he was withdrawn, when he was disorganized. But ultimately, the output that came up with that, he lifted the life up, he helped society lift up, he did so much for the river, so much for the planet. So, so we also have to look at it in the long run, how it comes out, or what is it that is burning inside the person, what is his passion that he wants to do, what. So in this case also, I had detailed interviews with him, hours together every time that he would come. So I wanted to see whether he really has that compassion within him that drives spirituality. Usually whenever a person becomes spiritually advanced, his whole, his compassion and love increases so much that he wants to do things to remove suffering for others. So
Yes,
in this person, my whole observation that from his childhood till now, his only thing is his one pointed goal that he should become enlightened. Apart from that, he is not bothered about what is happening to his mother, what is happening to his friend. Now, for mother, he is the only child. He has
yes,
lost his father much earlier. He is the only hope. The mother wants him to marry. His mother wants him to, be like a normal person. But he actually has no compassion about his mother. Hmm? So for him, what matters is he says that step by step, my one and one, my chakras are opening up, and now I have reached this Vishuddhi chakra. I am going to reach my Ajna chakra, and once my full chakra is opened, then I will be. Then I say, okay, if the chakra opens, what will you do? This is a clear question, because then at least I will get some insight whether he is like Sadhguru he is going to do something great or something really selfless for the society. Till now, his whole journey is all about his own self. So
yes,
then he says, then what will happen? I don't know. Even now, what is happening, I don't know. Nothing is in my control. Everything is happening to me. I am not doing anything. And this, if
yes,
you look at Bhagavad Gita, Krishna tells Arjuna, Nimitta matram bhav savyasachin. Krishna tells Arjuna, you just become a nimitta and, leave everything on me. And with that, you will be able to overcome this crisis. So he quotes that and he says that I am only a nimitta. I am not a doer of anything. Everything happens through me. Now all the trips that I went without informing my mother, I went to Rishikesh, I went to Haridwar, I was in Himalaya for 3 months. I just decided to go to Banaras, and from then I got a thought, or somebody guided me that I should go towards Himalayas, and I went there. I went all around and I came back. I didn't have any plan. I was not even planning the next moment or next day. It was some divine force which took me through, and it wanted me to be exposed to all these scenarios because it wanted me to go through a very deep spiritual process, and it was preparing me for that. And then I came.
Yes.
Then I asked him, then for these 3 months, your mother was worried. She was suffering. No. So then he says that whenever I got thought of my mother, I was in touch with her. I was calling her. I was telling her that what is going on with me. And so then I say that, then what are your plans? Like, your mother really suffers. She wants you to marry. She wants you to settle down. Then he says, that is not in my hand. Wow.
Yes.
I don't know how life
Dr.
wants to use me. Yes,
Dr.
Meena.
Hemant, even Buddha did this.
Even Buddha did. He left his
Did
family,
it?
wife,
Yes.
and for hours together he was in oblivion. Then he came back. So,
Oh,
and catatonia, like people in samadhi, they remain in that state. He feels he is out of that body. He cannot.
Anandamayiva used to do it. Catatonia.
So if he is there in catatonia, so my question is, are we creating this anxiety, depression, and all these things by giving him medications?
Yes, sir.
And whether if we would have left him as he is, whether he would have resolved it, or he is getting more complicated.
Yes. So, it ultimately the discussion boils down to one point that, like, most probably, like, am I right? Like, it all depends on an individual's perspective,
Am I
sir.
to
Like,
judge?
how I'm.
Who are we to judge, and who are we to
Who are
decide?
we to
Yes,
judge?
exactly.
So this is why this is such a complicated issue. In the history, if you see, it appears okay, it is clear-cut psychopathology, but
But we do have
our
literature,
spiritual,
sir. Like, but it all depends on an individual, I guess, sir, to judge, like, or to be judgmental at all. That is a question.
that is the question.
But
Do
then, sir,
do
again, in the question itself, you had said that the foundation of real spirituality is yamas and niyamas.
Hmm.
Whether he followed that or till date and practicing it for a quite long period would lead you to certain things. And then if that is the foundation of
Yeah.
real spirituality, that is not noticed.
Yeah. Vaishnavi ji has a point. So let
But
us see what Jayesh ji and Sujata ji have to say. Then we will come back, Vaibhav ji. Yes, Jayesh.
yes, sir.
हाँ सर, अभी ऐसा है कि हमारे कुछ आध्यात्मिक पुस्तक खास करके जो अभी लेटेस्ट बने हुए हैं ना,
हाँ।
उसमें ये सारी चीजें बहुत अच्छे से परोसी जाती है।
हाँ।
कुंडलिनी जो है, इट्स अ वन काइंड ऑफ माया ऑल्सो,
ओहो।
और उसी माया में फंसते हैं सब,
हाँ।
क्योंकि हमें क्या करना है कि वो पावर अचीव करना है इस तरह से। और अगर उसको जो अगले डॉक्टर ने बोला कि भाई जो कहते हैं कि भाई कैसे डिस्टिंग्विश करे, इसको कैसे अलग करे, तो जैसे गीता के 13वें अध्याय में इसको बहुत क्लियर कट किया हुआ है।
ओहो। हाँ, हाँ।
ज्ञान और अज्ञान के पूरे लक्षणों को वर्णित किया हुआ है। अगर उसको सही तरीके से समझने की कोशिश करें तो मतलब ऐसा नहीं है कि शास्त्रों में सब कुछ है, पर सही शास्त्र मिलना ये भी एक भाग्य की बात है जो गाइडेंस मिलता है। तो आजकल के जो लेटेस्ट गुरु है वो स्पेसिफिकली ये प्रॉब्लम भी जनरेट कर रहा है कि भाई ओरिजिनलिटी को दिखाते नहीं है, वो सिर्फ वही परोसे जाते हैं जो उन्होंने समझा है। तो जैसे कृष्ण ने कहा लास्ट में कि भाई अब आप इसको समझ के अपने निर्णय से चलो। तो इन जनरल तो क्या होता है कि इट इज काइंड ऑफ कि भाई सबको ऐसा ही है कि भाई आप हमारे ग्रुप में आ जाओ, आप हमारे ग्रुप में आ जाओ, यही ये मार्ग चलता है। इसलिए भी कई लोग ऐसा नहीं है कि हर एक जीव है वो साधक ही है, पर साधना में भटकना बहुत लाजमी होता है जब हमें सही मार्गदर्शन नहीं मिलता है। तो इस कारण भी जो आपने बोला कि समझ पाए कि भाई उनको क्या एक्चुअल प्रॉब्लम है, तो साधना का बात तो उनका खुला ही है अभी भी, पर उनका आकर्षण जो है वो मतलब है कि लाइक कुंडलिनी जागृत करनी है, तो वो गलत है। क्योंकि स्पिरिचुअल एडवांसमेंट ओनली कुंडलिनी जागृति से ही नहीं है, क्योंकि सारे जितने भी आध्यात्मिक गुरु हुए उन्होंने भी बहुत इसके बारे में बताया नहीं है। उन्होंने ऐसे ही बोला है कि भी आप अच्छे मार्ग पे चलो, अपने जीवन को सही रखो, इसी से अच्छा होना है। तो इसको भी समझना बहुत जरूरी होता है।
जयेश जी, आपने बहुत सुंदर पॉइंट रखा है और आपने भगवत गीता का भी रेफरेंस दिया कि 13 चैप्टर को हम अच्छे से और उसको देखना चाहेंगे कि उसमें ज्ञान और अज्ञान का क्या डिफरेंस कृष्णा ने बताया है। अक्षर ब्रह्म योग का चैप्टर है। और उसके अलावा आपका ये जो पॉइंट है कि हिज zeal to awaken कुंडलिनी एंड कुंडलिनी ऑल्सो कैन बी ए माया, ये पॉइंट
यस जी।
बहुत इंटरेस्टिंग पॉइंट है। सो वेरी गुड पॉइंट एंड आई एम रियली लाइकिंग इट, ये थोड़ा डिस्कशन होना चाहिए और डिबेट होना चाहिए। तो Jayesh ji also feels that this is wrong, that he is passionate only about his kundalini. Sujata ji, what did you want to say?
Sir, the hand just went up like that. Sorry, sir.
Okay.
Yeah.
No problem, no problem.
Being passionate about enlightenment is wrong. Is that the question?
मीना जी पूछ रही है कि मेरे एनलाइटनमेंट के लिए पैशनेट होना गलत बात है क्या?
What I think is being passionate about getting enlightened is not wrong, but then following a proper way for it, like whatever is prescribed, even for yoga, it is Ashtanga yoga. So properly following that is required. It's a prerequisite, I believe. Just having a
So the
passion
guru
for
is
getting
right?
enlightened
Sir.
will not serve the purpose.
Yes,
So
Vaishnavi
is the
ji.
guru who stands corrected?
What Meena ji?
Meaning the Margadarshi, is it that, I mean, for example, I'm passionate about enlightenment. Then if I fall into the hands of a wrong guru, then I will focus on wrong things.
Yes.
So am I wrong?
You are not wrong, but you will suffer. And people around you also will suffer.
Yes. So this guy being passionate about his enlightenment is nothing wrong.
Being
He going on his
passionate about
own.
enlightenment is nothing wrong, but you should be able to get correct guru. See, the example that they give is that the path of spirituality is like you have a ship in ocean, and it is such a vast ocean that whichever direction you see, everywhere there is only water, and it is cloudy. You can't see even the sun for you to know the direction. And now your boat is sailing. Now in this way, if you have somebody who has the compass and can correctly guide you, then only your boat will reach the goal. Otherwise, your boat will keep revolving in that vast ocean in the same area. So that's why Jayesh ji is emphasizing the guidance coming from correct scriptures and the guru which bases his understanding on those scriptures. जयेश जी यही बोलना चाहते हैं या और कुछ भी बोलना चाहते हैं?
हाँ सर, बिल्कुल वही। और इसी योग सूत्र में भी बताया गया विभूति पाद के बारे में, जिसमें कहा गया है कि इसमें फंसते हैं आगे जाके साधक, उसको केवल्य नहीं मिलता है।
एंड
तो
इन दिस
वो
केस,
सारी, हाँ,
इस केस में आई ऑब्जर्व ए सेंस ऑफ ग्रैंडियोसिटी बीच बीच में आता है, जैसे कि ही सेज व्हेन आई गो आउट ऑफ दिस टाइम आल्सो व्हेन ही वाज एडमिटेड, actually he was admitted for the 4th time. His mother is still with us. Yesterday he absconded from here. So the thing is, this time when he came, he says that when I go out of my body, I can see things happening in another room. I can smell fragrances or things that are kept in another room. तो मैंने उसको बोला कि अगर आप ऐसा है तो यार आप इस रूम में बैठो, हम उस रूम में कुछ करते हैं, आप हमें बताओ क्या चल रहा है. Because okay, this is another way, in spiritually advanced, you say that okay, I have spoken to God. अब वो लोग बोलते भाई मैंने भगवान से बात की. तो जब रामकृष्ण परमहंस भी काली माँ से बात करते थे, when Ramakrishna Paramahamsa spoke to Ma Kali, and if you go into the dialogue, you say, okay, what did Ma Kali say? So Ma Kali say that tomorrow a person is going to come with a mango basket. So दूसरे दिन सच में एक आदमी मैंगो का बास्केट लेके आ जाता था वहां मंदिर में. तो ऐसा अगर वो डिल्यूजन है या वो साइकोपैथोलॉजी है या स्पिरिचुअली एडवांस्ड है, then you should be able to go into that dialogue कि okay, in future when you test it, whatever he has communication with that higher force, does it come true? So in this case, when I told him, will you do it in front of us? We will keep something on the other room. Will you tell us? Then he says, no, I can do it only when that phenomena happens with me. मैंने बोला, when will that happen? That I cannot say when it will happen. वो कब होगा मैं बता नहीं सकता हूँ, वो मैं तभी करूंगा जब वो मेरे साथ होता है. फिर any question you ask him, anything you ask him, he says, it is not in my hand. So nothing is in his hand. So, but that is also there, in the sense of doership reduces. So it creates a kind of a confusion. But he was not able to demonstrate anything extraordinary in our meeting so far, but he claimed a lot of extraordinary things. He even said that you don't have to give me medicine, you just keep the medicine in my hand, I will absorb all its property within me.
Sir,
Yes.
Can
yes.
I share? Sir, I feel the main, like the discussion right now which is going on here is like from the psychiatric point of view, whether is it a psychopathology or it's a spiritual advancement. But I think the main conflict is arising in this point, that is in spirituality, there is nothing considered abnormal. Like everything is like a flow of energy, and basically the compassion is what is matters in spirituality, and there is no judgments passed in spirituality, I guess. Like in the field of spirituality, there is no judging person there. It's like just through the compassion, the abnormalities are thought to get healed. So in that sense, so like in
मैं
integration, as
आपसे
far as
ये पूछना चाहता हूँ कि मान लीजिए ये पेशेंट को उसकी मदर आपकी क्लिनिक में लेके आती है, आप क्या करेंगे? आप उसको एडमिट करेंगे या नहीं करेंगे? She has got into demands because mother is suffering.
Yes, sir.
अब वो हमारे
Definitely.
तो हम क्या करें?
Oh, definitely compassion, just through compassion, everybody would be ready to help our mother or that person, the person as well. Like being with him is, but not judging is good, I guess, sir.
Non-judging is good, but इसमें basic question ये हो रहा है कि उसको दवाई देना है कि नहीं देना है?
दवाई
बिना डायग्नोसिस के कैसे दवाई देंगे उसको? Yes.
But when we say psychopathology, like the psychotic person and the spirituality, there is one point where awareness is there in spirituality. Like person is aware what is happening, but here he is not even aware what is happening with that. So when it comes to not, he was saying that not judgment is not there in spirituality, but with non-judgmental thing, awareness is always there with the person who's spiritual, that he's absolutely aware what is happening with him and all around.
So she emphasizes the point that though it is non-judgmental, but it is still awareness is there. Non-judgmental is one aspect, awareness is another aspect. In spirituality, both are combined. It is non-judgmental awareness. So you should be aware. So this is important. Now let us look at this case now. I think we had very useful discussion. In this case, according to Aishwarya, what was present, what was absent in this table that we published? Let us see. Yes, Aishwarya.
Okay, sir. Like first we will see the history of spiritual practice. So it was present. And like regarding appetite and recreation, it was towards the extremes, because like sometimes he'll not eat any food and he'll suddenly go for pilgrimage or meditation, and sleep cycle was not regular. Also sleep, that also towards the extremes. And considering the dressing, he was also always poorly dressed, but not very messy also.
So that is there in both spiritually advanced also, and this is also,
facial expression was always calm and composed. He was never seen anxious, fearful, or neutral. Like I'm at this point of time, I'm telling. And his eyes, voice, everything has no change. and psychomotor activity, catatonia is present. That he shows that.
But whether that is meditation or trance or samadhi or catatonia, we don't know. So probably for this, we have to give him point both side. Okay.
Okay. So, and regarding the speech, he maintained the spiritual ecstasy was there. And regarding speech, he was every time interested in speaking about spiritual things.
Also goes in favor of spirituality.
Favor of spirituality only. And regarding the thought, we consider it as delusions, wherein delusions of control, grandiosity.
This is a very important point. See, all other, so far we see scores are equal. Now, when here, how do you differentiate faith from delusion? See, in psychiatry, the definition of delusion is, it is false, firm, unshakable belief, which is not in accordance with the socio-cultural background of the person. False, firm, unshakable belief, not in accordance with the socio-cultural background of the person. So how do you justify that, Aishwarya, here, that he had a delusion and it was not faith?
Sir, he always tells that he's being controlled by Sadguru, his actions. Even the actions of those who are around him are controlled by Sadguru or the Supreme Self. And he always tells about the opening of third eye. And here it was clear that he had a mark in the forehead, and it happened during the hitting of head, banging of head, but he considered it as the third eye. And also, like while the nasal bleeding was there, he considered it as as the blood collection in the third eye. But when the investigations were done, he had a pathology. So.
Okay, so Aishwarya, so here, how to differentiate, there is a point here by asking justification behind the belief and assessing the effect of this belief on socio-occupational functioning. So when he says that I have a third eye, we asked him, okay, so what do you mean by third eye? Or when third eye is opening, actually, what is going to happen? So he says that even the bleeding that has happened from the forehead or from the nose is the process that are related to his third eye opening. So when we asked him, do you have any reference to show that before third eye opens, the nose bleeds? Or any phenomena, is there any documentation like that anywhere? No. I know it because I know it. So it is like, once after a certain point of discussion, he is not able to justify. Then we showed, okay, you had a mucocele in the nose because of that. So he said that mucocele is also because of my kundalini. That the processes that are going on. So here, though this belief or third eye or kundalini is there in accordance with his socio-cultural understanding from his childhood. His father was a yoga teacher. He would have spoken about kundalini. He would have spoken about all these kind of processes. So it is not something which is not in accordance like that. So anybody who goes to temple, and we bow down to the God, we may say that, atheist may say that it is a delusion. सब लोग जो मंदिर जाते हैं वो सब लोग deluded है. Everybody is deluded because it is a false firm belief. We say that it is in accordance with our socio-cultural background. That's why it is not considered as a psychopathology. So in the same way, this person believing that he is awakening his kundalini and all is fine, but then he is attributing whatever that is happening to his body to kundalini. That is what Dr. Aishwarya feels, that he was not able to give a proper justification. Yes.
Okay, coming to perception, sir, he is.
1 second, Aishwarya, there is one question. Yeah.
So when it comes to delusion and faith, where his ego comes?
It was done actually.
Oh, it is there. Okay, you continue. Okay.
Okay.
Dr. Vidya Lakshmi, what do you want to share? Please unmute.
Sir, in Ayurveda, actually, under Unmada, classification of Deva Unmada, Guru Unmada, such different condition is there.
Oh.
So Deva Unmada Lakshana is Saumya Drishti, then Gambhira. Like it looks like the person who is spiritually advanced, no? Similar Lakshanas we can see.
So means he
So
is possessed by a good spirit also.
yeah.
So
And
just
Adrishya Akopanam means they are not feeling angry.
So ये कांतारा मूवी किसने देखा है भाई? कांतारा?
Yes.
पुरानी केस भी तो सेम है.
हाँ. So Kantara movie में that Gulika and there that one Soumya Deva is there and one Ugra Deva. Raudra. So they in Ayurveda they are Gandharva or Deva or Rudra. Different kind of possessions can happen.
Yes,
So
yes.
Aishwarya, what is your understanding of these possessions?
There was a discussion regarding this, sir, the same. So, like, if it was considered to be a Devagraha, the person will have more Saumya qualities. Like he will be responsible for like dharma, his dharma he'll be following. And but in our case, this person is showing krodha and amarsha, at times irritability. Is at some point of time he hit even his mother. So, as such behavior patterns were present, when we had a discussion, Devagraha was not considered. We classified it into Unmada only.
Our another MD student here says that can we consider Pitragraha? Why do you say Pitragraha should be considered here?
He'll always look like Aprasanna Drishti. There's more happiness like while looking at him. He's restless, he will be like that.
Okay. So this is important. In psychiatry, we group all these possession and all these people, देवी आ गई है और ये हो गया, ये सब जो होता है इसको हम dissociative disorder के अंडर में डालते हैं. They are not psychosis. They are periods of dissociation where they lose that control over themselves and their subconscious mind takes over them. And in psychodynamic psychotherapy and all, it is explained in movies like कौन सा वो अक्षय कुमार का मूवी है यार, भूत वाला, भूल भुलैया में also, in that movie also it has taken both the aspects. So dissociation is another diagnosis that we should consider here. Whether he is dissociating, then what happens is that in those episodes of dissociation, अपरिचित movie आपने देखा होगा, where he manifests 10 different personalities within him, because his subconscious mind, whatever he is not able to express, is using that particular phenomena to manifest that. So dissociative identity disorder or going into episodes of dissociation can be another differential diagnosis which does not get treated by antipsychotics. And in this case, antipsychotics are not working. So I think we should also consider a diagnosis of dissociative disorder for him.
Yes, sir, but
main characteristic is that he feels that he is possessed by Sadguru or possessed by some higher force. He also develops that in the form of episodes. It is not there all the times. Dissociation also happens in episodes.
And also, sir, the patient was never compliant to medications.
Because he doesn't believe that he is ill.
Once discharged, so how, like, when he is presented with catatonia and all, when he's admitted, when we administer with antipsychotics, it work actually. Some irritation will be reduced, and but we were never able to observe his long-term adherence to medication.
And whenever he comes back to us, he would have stopped the medicine for a long time. Then only he is back to us. No. Okay. Continue. Okay, Dr. Vidya Lakshmi wanted to share something.
Sir, so if we classify under Bhutaja Unmada, it is considered as asadhya according to Charaka. But he says mantra and bhaishajya vidhi can be adopted in such conditions. So that is the reason maybe the medicines are not working in that person.
Which kind of mantra and what bhaishaja means what?
In general, they'll say, sir, mantra and bhaishajya vidhi. But specific, we have to adopt according to the patient condition.
Help us understand in more detail what can we do for this patient, even from this point of view, mantra and bhaishaja. What is there in the literature? Please.
Sir, under bhaishaja, I think the main medicine we are using Mahakalyanaka Grita. It is considered as Mangalyakara.
For did we use Kalyanaka Grita only here, Aishwarya? For Snehapana?
Kalyanaka Grita we used, sir, initially.
Initially, first Virechana was done with Kalyanaka only. He felt better also, but then after that again he is into the same.
Only 2 times we could administer him with Virechana because other times he was not interested in doing.
We decided to give Kalyanaka Grita only. In all cases of Unmada, we give Kalyanaka Grita only here. Yeah. Okay, and mantra, I think we have to see what kind of mantras, which kind of mantra help here. Okay. Continue, Aishwarya.
Okay. So regarding perception, patient denied any perceptual abnormality, like he was not hearing any voices in or in isolation, or he was not able to see any images that we didn't see like exactly, and I'm not able to conclude whether it is an extrasensory perception. So it is more kind of delusion than hallucination. So
he doesn't have any hallucination or extrasensory perception. Okay.
And regarding the socialization, he was socially withdrawn. And occupation, currently is occupationally handicapped. He used to enjoy and works with enthusiasm and all, but after within this 1.5 years, like he's also not going for work also. And regarding his socio-political forces, like it was affected, and he's not much affected about the surrounding things. And botheration regarding human welfare is not at all there. He is bothered only about his attaining moksha, his personal agendas. He's not even about mother. When we ask, he's telling everything will be all right. Everything will fall into place. I should not be bothered about that. And like other, he was also influenced by the culture and society, because his father was a yoga teacher and he heard about spirituality and yoga from his father, and he grown up reading such spiritual books. So there was he was affected by more society influences further. So finally, while adding the scores, we'll get like 6 in the spiritual part and 11 in skis.
Okay, probably with meditation, catatonia is little more, but slightly more points go towards this dimension. But as Dr. Vaibhav said, that we should not judge, but our intention is to help both mother and him. And with that approach, we tried to do Ayurveda, Virechana, we tried to give him medication, we tried to give him injections, depot injection, which can be given once in a month. But once he would take, next month he would not come. And the problem now is, in fact, I had a discussion with him to the extent that, okay, I believe that you have reached a higher stage of evolution. Now, if you stay in this worldly place, among people like us, then you will ultimately end up in mental hospital only. Why don't you completely get into that spiritual path only? You take your mother's permission, go to some ashram in Himalaya and do whatever you want to do there. You know, these phenomena, moving your head like a fan, doing all this catatonic posture, if you do in public, people will also get scared and they will again and again bring you here. So a real spiritual person does not do all this thing in public. He does everything in isolation. उसको यहाँ तक बोल दिया कि भाई तू चला जा जहाँ पे तुझे जाना है, अपनी मम्मी को बता के बार बार ट्रबल दे रहा है. Says yes, I will do it, but again he's there with us. So this is another thing. So we actually don't know. We don't know what to do with this case, and I request help from all of you. So please help us manage this. His mother is really bothered. Now we were also bothered the whole day. Today morning we received the information that he has reached his hometown Tumkur safely. Now today his mother will go. So he left because we told him that we will be giving him a depot injection, and then he left. He did not want to undergo another round of Virechana. He was not happy with taking ghee. He says, except ghee, I will not take that ghee again. Okay, next.
Dr. Hemant?
Yes.
Dr. Hemant?
Yes, madam.
Yeah, what I wanted to share, I think these days, it is not like a one-on-one Guru Shishya Parampara, like people are not guided properly because they learn a lot of things on the internet in a mass.
Yes.
And although they have real dedication, they are not directed properly. That's one thing.
Yeah.
And there is like in olden days, the Guru used to correct the Shishya and they were in the ashrams.
Yes.
They used to give up their samsaric life.
Yes.
So they are in normal society, but they are trying to follow these things in masses, on internet, on different ways. And as we know that they haven't probably followed yamas, niyamas correctly. Yes. And for this person, what I was also thinking, one of the doctors also typed in the text. So like if we are able to check their levels of cortisol, whatever the markers, which can differentiate from stress, from like somebody who is calm, you have different hormone levels and biochemical levels that might be able to differentiate, or doing like a PET scan to see different areas of the brain, or EEG when he's sleeping and when he's awake, might help to know in what stage he is.
Yes,
I wanted to share.
psychiatry, they say that this is the future of psychiatry. We call it biological psychiatry. But still, this science is still, in its preliminary stages, madam. It still has to evolve a lot more. No, but currently we have not reached a state where all these biomarkers will be able to differentiate this complicated question.
Okay. All right. Thank you.
Okay. But good suggestion. It is a, in future that should be our aim. Fine.
Definitely an EEG would help to know if he has got what sort of waves when he's in different states.
Yeah, means, see, the thing is, when he is closing his eyes, we know that as you open your eye, beta wave comes. Otherwise, alpha dominance goes with meditative experiences. Alpha and theta dominance comes. So when he is meditating, when he is focusing on something, when he is chanting some mantra, some changes will happen. But these phenomena are so subtle, so deep, so whether even a patient who has schizophrenia also closes his eyes and chants certain mantras or goes inwards may also show similar waves. So in that way, inside, whether my ego is getting deranged or my ego is getting effaced, because superficially both of them may be able to sit still and do it. But whether it is how deep I am going in meditation, or how correctly I am meditating, or what I am doing with my closed eyes. With closed eyes, many things can be done. It can be dharana, it can be dhyana, it can be samadhi, it can be samyama. What is going on? It is not possible. So that is why I say that these instruments are still very superficial and they will not be able to answer the question.
Sir, has there been any improvement in his behavior through this as you said, non-judgmental awareness type of counseling that you chose to do with him, has there been any improvement in his
No, he
behavior?
was very happy. He is very intelligent guy. He is a topper. He is a physics teacher. He teaches IIT people who are preparing for physics. So therefore, he was a very intelligent person. He answers all the questions like a very highly spiritually evolved kind of a person. Mm. So therefore, when I told him that I really, have that compassion towards you, and I think you are suffering and everybody is suffering. So why don't you do that? He says, I will do it. And he promises that next time it won't come. I will be able to cover all my things. I will do whatever I have to do internally, and I will not come to you. But he comes every few months. He is here. That is the problem. So with medicines, I said him, why do you come? Ultimately, he said that I think I come here because you doctor should be aware of such cases more, because probably future in future more of such cases are going to come to people like you. So to teach you people, I think Sadhguru sends me here. And so then I say, okay, then let us learn from it. And then
Learning process.
whatever medicine we give, then you take, because then we will learn better from it.
Great point.
Dr. Hemant,
Yeah.
one more point. Is it possible to contact Sadhguru and tell him this is maybe?
No, we have contacted Isha Center, their their Guru Mata or whoever that are there. And they have only told him to go to Nimhans and come to meet us, because they say that, this is the way that he is demonstrating, or the phenomena that he is saying that it will bleed or this or that is not there according to their science.
Yeah. And the third eye is not something physical, right? Third eye.
Yeah, correct. Third eye is not something physical. But
It's
he
not
feels some
physical,
kind of
but
sensation, something, and he says whatever that, even a boil here, he would say that it is a phenomena of internal thing that is happening, manifesting on his.
in Tibetan culture as well as in other cultures, there are instances where they do procedures for the third eye. I mean, the third eye is a book, if you read it. The third eye is a book.
Is a book.
Wherein the whole procedure is explained. I don't know, I didn't understand, make much out of it, but it's
So
a
according
physical
to them, is third eye a physical thing, Veena madam?
Yeah, that's what. It's a physical procedure in Tibetan culture. Tibetan
So
culture
that
has
is
a
why.
procedure where they do it. The third eye is the book which is written.
So this is a very complex thing, you cannot utter any statement without the, some other sites which say that, okay, this may also be true, that may
Sir,
also.
can his sattva and then gunatita can be studied here?
She will show you all the scores of that scale here. Okay, let us continue. It is already 4:20. Aishwarya, please continue. Please continue fast.
Yes, sir. Okay, well, then coming to the mental status examination, he's well kept and his attitude was cooperative, attentive. Rapport was easily established and eye contact was maintained. His facial expression was appropriate, and a slight excitement we can see while he was explaining about the experience of samadhi. And speech was spontaneous, coherent, and relevant. The tone, tempo, volume, everything was normal. The prosody was maintained. And coming to the thought content, there was delusion of control, that his actions are being controlled by the external force, and grandiose delusion that about the third eye and chakras getting opened. And we call these delusions as well systematized delusions. And subjectively, his mood was like, I am okay, and objectively, it was euthymic. Perceptions, he denies any visual or auditory hallucinations. And while coming to the cognitive assessment, everything was fine. Orientation, attention, and concentration, memory, and intelligence, everything was intact. Finally, coming to the judgment, his personal judgment is impaired. That is, if we ask him about what is your, like, you're telling that you're on the way to samadhi, what is your next step, or how about your mother, or about your career? So he replies like, even he doesn't know what is going to happen next moment. Everything is controlled. He's not at all bothered also. about the finances, how to manage finances, like that. So, and his future goals, everything he has already left to the higher force. And social also partially impaired, and test judgment was intact. And like regarding the insight, there is no insight, like awareness, attribution, acceptance, everything is absent. He doesn't consider this as an illness.
Okay. Yes.
Next comes to the yogic assessment part, sir.
Yeah.
While coming to the Annamaya Kosha, he is able to maintain the comfortable posture like for 45 seconds in an asana, and flexibility is 19.3 centimeters. And coming to the Pranamaya Kosha, his respiratory rate is 12 per minute, pattern is thoracic breathing, shallow. And Andhara Kumbhaga 44 seconds, and Bahi Kumbhaga is 12 seconds. And Prana reset time is 1 minute 15 seconds.
We will explain you all this, what they are, Pranamaya Kosha. Yes, continue.
And Manomaya Kosha assessment, like AUMA scores, when we see, U is dominant 100%, and then it comes to A, 54.8, and Ma is 43.3. So he's a U dominant personality. And while coming to the kleshas, in the Asmita, Sattva is 75, Rajas is 75, and Tamas is 85.7, Gunatita is 64.3. Raga is 64.3%, Dvesha was 50%, and Abhinivesha was 45.2. And finally, we can conclude that he is a Ukata dominant person, and Sattva Tamas predominance is there. Okay, sir.
Okay. So, Sattva Tamas dominance. Tamas is the highest score when we tried to assess the Asmita, and Ukara dominance in A, U and Ma. U is the one which is, more of thinking, less of doing, and losing touch with reality. That was there. And his Gunatita score is 64. Now, see, one thing that we should understand here is that people, it is a very thin line between Sattva and Tamas. A Sattvic person also may not, do much of his action. A Tamasic person also may not do. Sattvic person may say that I have no attachment, whereas Tamasic person may be lazy to do it. So, lack of attachment also makes me run away from my dharma, and laziness also makes me run away from my dharma. So sometimes what happens is people who have tamasic tendencies use the shield of being sattvic, or people who cannot do their duties properly hide behind spirituality and not do it. So there are many such people, because of which society is suffering, who go into Brahma Kumaris or get into different kind of spiritual organizations like ISKCON or somewhere, where they could do much more productive activities if they were there in society. But they choose to do that. And but another way, like Dr. Meena was saying, that Gautama, the Buddha also did that. But one person in a million doing it and majority following that person, what will it do to the society? So therefore, what is right, what is wrong? It is very difficult to answer. But in one way, in the yoga philosophy that we try to answer this question is by saying that, okay, you do it. But if majority of the people on this earth do that, would it be fine? Would it be okay for you? Would the planet become a better place if majority of people on the earth end up doing what you are doing? Because Krishna tells in Bhagavad Gita that ultimately it is the human being has a tendency to put his Shraddha, and people knowingly or unknowingly put their Shraddha on people whom they admire. So therefore, knowingly or unknowingly, people end up following those whom they admire. So therefore, if there are many people looking at you, if there are the next generation who looks forward to what you are going to do, then Krishna says that even if in this all three lokas, there is nothing that I don't have. Still, I end up doing all my karmas. Morning, from the morning Vandana to evening Sandhya Vandana, and all the procedures I do, because human beings tend to follow me. And if I stop doing my duties, then I will be considered as the destroyer of this loka. Therefore, he uses a particular term, it is there in the second chapter towards the end. He says loka sangraha. It is that for the people, to guide them, that even if a person is highly spiritually advanced, he should behave like worldly people, so that people who do not know do not run away from their duties. So अगर आप spiritually बहुत advanced भी और आपको बहुत वैराग्य भी आ रहा है, तो भी you should behave like people who are attached, so that people who do not know do not get confused. Okay, next. Aishwarya?
Okay, sir.
Continue.
Coming to the Ayurveda assessments, we assessed his Prakriti, and it is noted that he belongs to Kapha Pitta Prakriti, because he has the qualities of like intelligence. He was always calm and composed, and his speech was clear and firm, and physical. And coming to Pitta, like he was always ambitious, and he had a well-built body that belongs to Kapha, and the competitive spirit was there within him in the primorbidly. So his bodily features also mostly match with a Pitta constituency and also Kapha.
And Kapha, and it goes with the Tamo Sattva that we see in the Manasa Prakriti. Here Kapha Pitta, there Tamo Sattva. Okay.
Okay, sir. So while coming to the Vikriti Pariksha, like we will assess each component of the patient. Like dosha, current doshas involved are Vata and Kapha. Vata, because he shows the like features like wandering behavior, thoughts not keeping in with reality, then sudden irregular movements, this posturing, everything belongs to Vata. And Kapha, because he always prefers to be alone, and reduced self-care and food intake, everything was seen. So he also has the features of Kapha, but more Vata predominant. And while assessing the Dadu, Rasa Dadu is affected because he reported Shabda Sahishnudha, like sensitivity towards loud noises, and mental fatigueness was there. And the affected region is Manas, and Rogi Bala is Madhyama, and Kalam is Purana, as it is 1.5 years since the disease manifested. And Prakriti, as we told, it is Kapha Pitta only, and Agni was Sama. Vayas is Madhyama, Sattvabala is Madhyama, Satmya is also Madhyama, and Ahara Shakti is also Madhyama. Coming to the Nidana, that is like we can say it as causative factors. Viprakrishna Nidana can be correlated to like predisposing factor. It is, we can consider as Bija Dushti, like psychosis in father, we have query, and precipitating factor like Sannikrishna Nidanas being, we have mentioning of Tantra Prayogam Abhi Vishamachara, Anyasya Sharira Cheshta, in Charaga Nidana, and also in Charagan Chigilsa, Acharya has mentioned Niyama Vridadi Mithya Krudam Karmam. Like that, that means improper practice of yoga and meditation, or whatever activities described in the Shastra, ancient texts and all, he was practicing it not in the proper way and not under a proper guidance. So that is the main causative factor, precipitating factor for the current illness. And while coming to the Samprapti, we can see there is a dosha koba due to all the causative factors which lead to the rasa dushti and also the dosha koba. And like as the rasadadu and rasavahasrodas and manovahasrodas shares the same site, that is hridaya, which lead to the mahanovahasroda dushti, leading to vibrama manifestations and leading to unmada. And while assessing the Vibrama, I think everybody is aware of Vibramas, Ashta Vibramas of Unmada.
So according to Ayurveda, these are various aspects like in mental status examination from modern medicine you have. They say Chinta, Vichara, Uhya, Dheya, Sankalpa, Indriya Abhigraha or Swasya Nigra, self-control, control over senses.
These are related to mind, sir. Ashtavibраmas are like related to Manas, Buddhi, Sapnya, Smriti, Bhakti, Sheela, Cheshta, and Achara. I'll explain. First, we will go with the Manas. In the Manas aspect, almost every functions of mind is affected. That is Chinda, the ability to process information in meaningful way, or the ability to enlist merits and demerits of the things. That is Vichara, Uha, to ability to predict the results based on the available information. They are about the goal. He doesn't have only he has the goal of achieving the moksha, but he doesn't have the application knowledge. And Sankalpa, the clarity and understanding usefulness of an action. Indriya Abhigraha, control of senses is also not there. Self-control is also not there. So all aspects of mind is affected. And then the second aspect is buddhi. Buddhi is like unable to differentiate between what is good and what is bad for him. So personal judgment is impaired. And like coming to sapnya means orientation, that is intact only, and memory is smriti, that's also intact. Coming to bhakti, bhakti means like whatever things that we used to like earlier, now is unable to enjoy. Like etra ichha purvamasir tatra anichha bhavati. Like when we ask about him, like teaching, he used to enjoy and love teaching. Now he is telling there is no need. Like I don't find it I don't find it relevant, like that. He's telling. And also reading books. He used to read a lot of books, and now he's telling there is no need of reading books. Every knowledge will come to me. So he has reduced interest in such activities now. And his Sheila, he he gets irritated, and he has pushed his mother. So temperament is also affected. Sometimes he get irritated and agitated also. And psychomotor activity is also affected, as we can evidently catatonic posturing is seen. And like he's spinning like a fan. So cheshta is affected. And achara, like which is a general code and context, which are prescribed in the ancient texts. And he's following the dinacharya, maintaining personal hygiene, maintaining a correct sleep-wake cycle. So all those things are affected now. So we can, among the 8 vibраmas, 6 are affected. So finally, we can see what are the symptoms he's showing, like paying inattention and panicking inappropriately. That is mentioned as dhyana udvegam cha astane. That is a feature of vada. And anga vikshebam agasma, that is irregular movements. That's also vada. And unmada chittottam is also a feature of vadiga unmada. And ananna abhilasham is a predominant feature of kapha, which is he's not inclined towards food. And also we can correlate like decreased personal hygiene, that is also kapha feature. And wandering behavior is vada feature. And he always prefers to be alone, that is called rahaskamata, which is also a kapha feature. So we can diagnose the cases like vadaja unmada with kaphanubandha. So this was our conclusion.
Yes, yes. So very, interesting case, and you can see how elaborately the case was understood from yoga point of view, from Ayurveda point of view, from modern medicine point of view. Mainly, this case we chose to discuss today to ignite this kind of a discussion, that there is a lot of gray area and there is a lot of work that needs to be done. Definitely, who are we to judge? But ultimately, as doctors, you will get such cases coming to you and people will seek your guidance. So it is better to have more and more insights, and it requires more and more learning, So what was the treatment adopted? Treatment, basically, he underwent 2 rounds of Virechana with us, and antipsychotic medication, whatever that that she has already described in treatment history. 3rd round of antipsychotic injection we were about to give him, but he left the place. And this is a case that we will be following up. Okay, there is management. Okay, quickly just finish, Aishwarya. So in Ayurveda, they have done snehapana, chodana, virechana, then nasya, dhupana with jatamamsi, and kachuradi churna, chandanadi taila. These are the antipsychotic medications that were given. Yes. And what about anything else did we give, Aishwarya? Yeah, we had our yoga module, which is more dynamic to ground him with reality. Which oil was used for Nasya, Aishwarya? Aishwarya, are you there? You are muted, Aishwarya.
Yes, sir. Like for the initial admission days, we used Panchagavya. And currently we used in this admission, we started with Anutaila and Asya, and on the third day he left. So we were not able to complete the course.
Okay, okay. So we use this Panchagavya mainly for depressive things to activate them. And Anutaila for those who
For
need
Indriya
more.
Vishuddhi, we considered as like this time, sir. Clarity for senses. And that one Vadhara it is.
Okay. Yes, next slide. In yoga, we gave him more dynamic. Our psychosis module is more dynamic one. And to balance this abnormal activation of Kundalini, also we recommend that you chant Auma, that is as per the text, and some herbs which are medhya, which are enhancing the cognition, and of course lifestyle suggestions, sadhuvritta and other things. Okay, so thank you very much, all of you. Thank you once again, Aishwarya. Very good case presentation, and I hope all of you enjoyed this discussion today, and we look forward to many more such interactions. Yes. So, Dr. Vidya Lakshmi, yes.